Jeremy?
Yeah.
I'm Donovan. How are you?
Oh, hi, Donovan. Hi.
Good. Patrick?
Hi, Patrick. How you doing?
Hey, Jack.
Hi, how are you?
Well, how are you doing?
Hi, Crystal.
Hi, Jeremy.
And you already know Mrs. Abrams, don't you?
Yes. Yes, I was
Yes.
speaking to her just momentarily.
Yes, you are.
This, but Jeremy, I didn't know if you had caught that we were hoping, it was Dr. Murphy who had asked us to initially
Oh, Dr. Murphy did.
conversation.
Yes.
Not you, Crystal?
No,
Oh,
it wasn't me,
okay.
it was Dr.
It
Murphy.
was Dr. Murphy, yeah.
Okay. Oh, so he's the physician, because I haven't
Yes.
seen a physician.
Oh, okay.
Yeah. Oh, okay.
What?
Because I just got in. I just got in this morning.
Just came from California?
Yeah. Yeah.
Okay.
Yeah.
Let me preface it by saying, because he's not here,
Okay.
I'm not going to try to answer questions that are medical that I don't have the answers to.
Oh, good.
So if
Good.
we reach a point where it's questions around medical prognosis, I may have to defer some of those things just until we can get
That
Dr.
would be
Murphy back.
best.
Okay?
Yeah, that would be best.
I don't want to give you a false answer that isn't correct from his standpoint.
Okay.
I'm sorry he couldn't be here. He got pulled to an emergency.
No problem.
I don't think he's going to get back, but are you in town for...
Yeah, because I'm here with my wife for a few days.
Okay.
Yeah, we thought we'd come
Okay.
in because Crystal called and Dad with this last episode was in, so we thought
Okay.
we'd take the trip
Okay.
out.
Well, thanks for coming out. I know it's important to be here. I'm going to try to give just my brief understanding of the medical situation as Dr. Murphy's related to us, and as your stepmom has kind of filled in some of the gaps for me. I understand that he's been in the nursing home for about a year, and over that course of time has started to deteriorate. He's at the point now where Dr. Murphy feels he's permanently unconscious.
Oh, okay.
Is this new to you?
Well, because I did get a chance to see Dad, actually before I came here, and then the nurse kind of filled me in about that there was a meeting that we were going to have, and I was talking to him.
Mhm.
He was, I thought, he
Was he
blinking.
responding to you?
Yeah.
He was
I was getting,
responding?
there was something. I mean, he's not going to smile or talk and everything, but there was some movement there. I mean, his eyes are open.
Mm-hmm.
So, yeah. I mean, he's, yeah. I mean, I thought there was something going on. I thought there was something going on there.
Yeah.
So,
And-
I mean,
Yeah, I can't certainly
conscious.
answer that with any medical certainty beyond what Dr. Murphy has
oh,
told me
okay.
of.
Yeah.
It's what they call a locked-in syndrome. And
Yeah.
I'm not going to try to go in depth with that because that's a new one for me.
Okay.
But basically, his diagnosis is he may have some reflexes, he may have some movements,
Mhm.
but the elevator isn't quite connecting.
Oh,
to
okay. Well, I
all the
thought,
way up.
yeah, I thought I got through to Dad.
Yeah.
It's okay.
Yeah.
Because there wasn't anyone there. I mean, the nurse just happened to tell me at the meeting, so there was no
Mhm.
medical staff.
Okay.
So I didn't ask
Okay.
her anything because it was just Dad and I.
Okay. One of the questions that I think then, when we do touch base with Dr. Murphy, is
Mhm.
to have a very clear answer from him as to whether or not he feels there is any cognitive ability, any ability to interact, or any
Is there
potential
anyone
for
else
that.
who's actually seen Dad about this, Crystal, at all?
Dr. Murphy is in
Is there only
charge.
one? Oh, really?
Anyone who Dr. Murphy advises to see him will.
Okay.
Dr. Murphy is really in charge. Dr. Murphy's the person I talk to all the time.
Oh, okay, because I'd like to make sure that we're getting other opinions here
Okay.
also. That I don't want this to rely on just Dr. Murphy.
No,
If
Dr.
that's-
Murphy's been
Well-
his doctor for a long time, and Dr. Murphy
Okay.
has taken care of your dad for years. And
Okay.
anytime Dr. Murphy feels he needs consult or he needs someone else to check in on him, he will do that.
Okay, good, yeah, because I would like to talk to others besides Murphy.
Okay. Let me go with the assumption that what Dr. Murphy said, and I know he's had a consult in, because he's a primary care physician,
Yes,
so I
he
know
is.
he's had a neuro consult in. Let me go with the presumption, as hard as it is, that Dad is locked in and is never going to get any better than what we see right now.
Okay.
Which may be
Yeah.
something, or may not be, and we'll clarify that.
That I would understand.
Yeah.
I mean, Dad's not going to get better.
No, he's
Okay.
not.
But
He's
that's not to say
good.
that we have something here.
Okay.
So,
So at a
okay.
baseline, we have what we see right now.
Mhm.
Is that an okay place to start as a
Oh,
presumption?
yeah.
And if there's a
Yeah.
question about that, then we'll get whatever consults need to, so that your comfort level with that is high, okay?
Yeah.
So I think that's important that you have some comfort with the medical diagnosis that I can't give you, okay?
Okay.
When when we do an ethics consult, because I know you kind of walked into this, sometimes there's the presumption of something bad happened, somebody's doing something wrong. It's really not the case here. It's Patrick and I were really asked just to come in to facilitate the conversation when people are coming at it from a different perspective, which is very natural, and that happens a fair amount. We asked Jack to join us because he's obviously had more contact with Mrs. Abrams, and I don't know if you knew Mr. Abrams prior to this, or
Well, I brought in and said prayers for him.
Okay.
Because we can't communicate that.
Okay.
So that I've done, but outside of that.
Okay.
okay.
Okay, so you're not a medical doctor?
That's correct.
Well,
That's correct.
No, neither one of us are medical
you're not
doctors.
okay.
Yeah.
Oh, okay.
Our role here, when there's a conflict or
Mhm.
perceived conflict, is to act as mediators, and we come with some knowledge of the relevant legal and ethical principles that
Okay, say conflict. We have conflict?
Well, let me help get that on the table if it's not already there.
Okay.
As I understand it, after talking to Dr. Murphy, and you can jump in here if you'd rather
No, go
tell the
ahead.
story yourself,
Jump
okay.
in.
They had decided upon a do not resuscitate order, which meant that if his heart stopped,
You put this in?
Yes, I did.
You did.
Yes, I did.
I thought I thought a lot of this was going to be coming. You never called me.
I have the legal right to determine. I am
Well,
your father's wife.
Well, but back when we put Dad in the home, though, we had talked about that I was going to be helping you because you really you weren't able to make these decisions
But
at this
things
point.
have deteriorated since then.
Well, but you never called me, though.
I have to go with Dr. Murphy's advice. Dr. Murphy
Well,
and I have
I haven't met
discussed
Dr.
this.
Murphy, and honestly, I don't see it the fact, this is why I'm asking, I mean, we seem to be relying on just Dr. Murphy and a decision here, and I'd like
Dr.
other
Murphy is the
opinions.
doctor that your father has chosen. Your father, when he first became ill, chose Dr. Murphy. He trusted Dr. Murphy. Anything Dr. Murphy advised, your father followed. If your father was sitting here today and you asked him what doctor he would want to go to, it would be Dr. Murphy.
Okay, well, that's
He
all
trusts-
fine.
He trusts
Yeah, that's
Dr.
fine,
Murphy,
but...
so therefore I have to go with what Dr. Murphy thinks is best for your father.
Well, I'd like to talk to Dr. Murphy about
Because
this.
I believe that is what
We'll have
your
to
father
set
would
that up
like.
here.
Okay.
Well,
Yeah,
I'm sorry this is all so new to you. I was under the understanding that you were aware of this, but
I was not aware of all this. And Crystal, I thought we agreed to, I mean, you could have gotten hold of me yesterday. I mean, I actually didn't catch a flight till this morning.
I understand.
I mean, when did you issue this DNR?
okay. Let me clarify a little bit. For one thing, the doctor issues a DNR, okay? It's a medical
Okay.
order. Usually in
Okay, when did
conversation
you
with the family.
agree to this
Dr.
on your
Murphy,
own?
I agree, not on my own. I have the legal right to make this decision. It is my decision. You are in California. I am here taking care of your father as best as I can. This is the man I married.
Well, about a
This is
year
the
ago,
man
you
I
gave that
love.
up by putting him in a home.
I didn't
We
give
had
it
agreed
up.
about
We put him in a home because I could not take care of him on a daily basis. I did not give up anything. I put him in a home. Dr. Murphy is still his doctor. He was his doctor before he was in the home. It is nothing different than if he was living in the house with me. It is just that physically I am no longer capable of taking care of him. But the home calls me whenever there is any issue because I
Because
am
you
his
live there.
wife. Because
Because
I
you
am
live
his
here.
wife. No, not because I live here and you don't, because I am his wife and I have the legal authority over your father. Your father is non-responsive. He cannot tell the doctor or the nurse or anyone in the home or you or me what he wants. But I know what he wants. He wants what Dr. Murphy believes is best for him.
After a 10-year marriage, you're making an assumption.
I'm not making assumptions. I had 10 years with
You
your
have,
father.
and I have 34 more years over
But
that.
you're in California, and you are living your own life, and you can get on a plane and come here
Dad
for
is
a day
mostly,
or 2
Dad is part of
days,
my life.
or
You know
whenever
that.
you
When I
want
moved
to
to
come.
California, you know Dad was part of my life.
That's right, but you can come here whenever you choose, and then you can
And I
go
have.
home, and you can do what you do at home.
Let me jump in.
I'm here with him every day.
Okay, let me jump in for a second. Jeremy, what would, putting aside the DNR order for a second, putting aside even issues beyond that, what's the best that you would see for your dad from here? I mean, what would be your hope for the future with him?
Well, Dad's not going to get better. He's just not going to get better. But I just seen issuing DNR is like, he's dead. And he's not. I saw him this morning, and I was getting, he heard me.
Okay.
Dad heard me.
What's your understanding of a DNR order?
A DNR is, that we're stopping treatment on Dad.
Okay.
We're just stopping anything that could help him to at least keep going.
Okay, let me at least clarify that. Because a DNR order doesn't mean you stop
Excuse me.
anything. What it does do is draw a line out that says, if despite everything that we have done, he doesn't respond and his heart stops and he stops breathing, that's when someone dies, that we would not do the chest compressions, put him on, well, he's already on a breathing machine, use the kind of high-powered drugs and shock him to kind of try to restart his heart. Again, this is my opinion, but as a non-medical person, but CPR is really designed not for a young person, not for an older person who's at the end of life, but for a young person in a sudden accident. Okay, so I don't think a DNR order, it certainly doesn't mean we stop treating, it doesn't mean we stop caring at all. There's a very different line there between treatment decisions and a DNR. A DNR just says if we get way down that road and we kind of accept that the end is here, rather than prolonging it for about 30 minutes. Okay, does that distinction help any?
Well, Laura's due in September. Dad only had, I'm Dad's only kid.
Mm-hmm.
This is going to be his only grandchild.
Mm-hmm.
I just don't want things to get to the point to where all of a sudden I find out Dad's gone and actually, that he was not assisted, and or the fact that this DNR has pretty much killed him. Has pretty much killed him, and then
That
he
is
missed
not
out on the
killing him.
fence.
Your father is dying. He is being artificially.
Yes, he's dying.
He is
But
being
if you can
artificially
continue help,
kept
but
here.
if you can continue to keep Dad here as long as we can, I can't stay for 2 months, because Laura's got to have the baby back in California. But after the baby's born, we're coming back out to see Dad. And that.
You will see Dad, but Dad will not see you. I'm
You
sorry.
don't know that.
I'm
You
sorry,
don't know that.
your
Dad
dad
saw
does
me
not see you.
today. Dad saw me today.
He is
Crystal.
not
No,
responsible.
Crystal, no.
Okay.
Dad saw me, Crystal.
Okay.
That's
Dad
something,
saw me.
that's,
Like I said.
I understand your feelings.
Just because I moved to California and I've been there for a few years doesn't mean I've totally lost all reality of what kind of relationship I have with my father.
No,
Like I
I'm
said,
not doubting
I've-
your relationship.
I know when Dad hears me.
I am not doubting your relationship
I know when
with
he
your
hears me.
father.
Okay. I can't answer that, obviously. I don't, no one can tell if, unless they're speaking back to us, if they hear us and understand us. I mean, that's just not something we can tell from the kind of reactions he's giving us. I'm not saying you're wrong. I'm saying I can't be 100% sure.
Did Dr. Murphy say anything? I had my lawyer call, like Dr. Murphy's office, just to find out what was going on. To see what has Dr. Murphy said anything about my lawyer contacting him?
Just that fact.
Just that.
That was
yeah.
it, and he didn't say anything more.
Why would you have your lawyer call Dr. Murphy and not you?
Because
If you're
this is something that we're
concerned about-
deciding together.
if
Because this
you're
is something we're
concerned-
deciding. This is something that we're working together on.
If you were concerned about your father's
You rushed pretty
well-being,
quick to issue this DNR without calling me
If
here.
you
Maybe
were
it was a good
concerned-
idea. I did call the lawyer.
maybe if you
You
were
could have picked up the
concerned,
phone and called me and said, here's where we're at, and Dr. Murphy has suggested that we issue a DNR.
when was the
Where was
last
the phone
time
call,
you called
Crystal?
the nursing home to
Where was
ask
the
how
last
he
time?
is? When was the last time you talked to the nursing
You
home?
could have picked up the phone call.
You couldn't
could have
call
picked up the
Dr.
call.
Murphy
Somebody-
and find out how
Call
your
the
father
home.
was? Have a
Okay.
lawyer call
I didn't
Dr.
know it.
This
I
is
didn't know.
something-
As far as I knew, Dad was status quo.
Then why is the
Something-
lawyer calling the doctor?
He goes in the hospital, and you're so quick to make that decision.
Why is the lawyer calling the doctor? Why wouldn't you call the doctor and say, doctor, how is my
You seem a
father
little
doing?
quick to get rid of him here.
I'm not trying to
You
get
seem
rid
a
of
little
him.
quick to see Dad go
I
here.
am not trying to get rid of him.
You're-
I am not.
Can I try to get us, I think the point of today's meeting, honestly, you two obviously have very different feelings on this, which is, you'll have to discuss that.